We went up there, it was misting, bad day to go skiing. And they reopened the hill for us, they had it closed. The fella that was grooming the hill didn't realize it and he left some snow in front. And when I came around the curve, I hit it. And my right ski did not release and I tore up my knee pretty bad. I had no problems for quite a few years, but over all those years of favoring it, my left one started going bad. Eventually I needed the knee replacement. I'm the kind of person that, let's get it done and get it behind us. I never was worried once. I'd go in there and knowing I'd come out a different person. 2014, I had the second one. And having gone through it once, I knew when it was time, and Dr. Grace agreed with it, and we had it done. I couldn't wait to get back to what I do, and it didn't take long. I know what it was like without OSMS before the surgery, and I was hobbling around. After the surgeries, I could do anything. Because of OSMS, I can still climb ladders. I go into burning houses at 71 years old, and I wouldn't have that opportunity without the surgery. The fire department keeps us pretty active. There's 180 miles we have to cover. It's tough at times, but we cover it and we do a good job, and people depend on us. It's gratifying to be able to do this. I'm real happy. If we have to go in a building, the air tanks are about 40 pounds. When we search and rescue, we're crawling. It's fantastic that is, in my eyes, that I can do it. It takes a lot of strain climbing ladders on the knees and ankles, and I'm able to do it. I can walk the best of them. I do run at times when it's necessary in a fire or to stay safe. Without OSMS, I wouldn't be out there to help people. And that's my best and greatest gratification, that I am able to do it. I'm back to the life I love.